Many of us are taking to the streets to get our workout in, but foot problems can make you feel stuck, running in pain, and nobody wants that. Orthopedic surgeon Dr. Dolfi Herscovici joins us now with some tips on finding the best running shoe to get you up and moving. Nice to see you, doctor. Now let's first establish that you know what you're talking about here because you specialize in foot and ankle pain and trauma, correct?
Yes, that's exactly right.
Okay, so tell me about the typical patient you see who comes in to see you who is a runner. What kind of ailments might they have?
Well, everybody comes in and complains about foot pain, obviously. That's why they're there. Mm-hmm. The people that are the advocates for running, you know, they tell me when they run 10 miles they have pain, but when they run 9 miles they don't have any pain. So, you know, part of the problem is shoes. That's obviously one of the big problems that they have. And then the other problem is mechanical. Somebody who runs 5 to 10 miles a day, 7 days a week, that's going to cause some breakdown eventually. Some soreness in their foot, their Achilles hurts, then they start complaining of knee pain, their back starts to hurt, their hip. And a lot of it has to do with the fact that it's the shoe wear, it's the type of socks that they wear, and it's the surfaces that they run on. Before we get to the surfaces in the shoes, two very important things. Is running not for everyone? No, it is not. I give people, and especially my patients, my wife. My wife was a runner. She used to run 4 to 6, maybe 8 miles a day. But it just really got so bad that she had problems with her knee, and she can't run anymore. And the problem is that these people are addicted to running. It's an endorphin. They love to run. They get outside, they run for 6 to 8 miles. They feel great. Their body feels great. But things start to break down, and for her it was her knee. She can't run anymore, and that really bothers her, so she had to switch to something else to run. Okay, and there are alternatives. Absolutely. You could do, as we talked about in the commercial break, an incline, high incline walking on a treadmill. Does it do the same thing, same benefits as running? Cardiovascular fitness is just that. You don't have to run to be cardiovascular. You can ride a bike, you can swim, you can do elliptical, you can walk on an incline. Those are all activities that'll be great for your heart, get you fit. The problem that people run into is that they think that exercise is going to make them lose weight. And that's what patients tell me. Oh, I've gained all this weight and I haven't been able to exercise because my feet hurt. Well, you know, it's diet that makes you lose weight. Sure. The exercise makes you fit. And so there are lots of things. They can row, they can swim, they can ride a bike, they can walk on an incline, they can do elliptical. Any number of lower impact activities, because running is, as we know, very high impact and can be damaging to the joints and to the feet. So, okay, so establish this. If you are a runner, what kind of shoes should you be looking for so that you don't have you know, you want to minimize as much of the pain as possible? What I tell patients is that your foot is going to maximally swell in the afternoon. And so you should be trying on shoes in the afternoon. And your shoe size should be 3/8 of an inch longer than the longest toe in your foot. Now, some patients have what is called a Morton's foot. And what that means is that the second toe is longer than the great toe. Yeah, I have that. It's really embarrassing. Well, the problem is... Well, Rob's laughing, but it is. It's really embarrassing. The problem is... Well, the problem is that when you look at shoes, most people size it on the big toe. Yeah. So if you're sizing your shoe based on your big toe and your second toe is longer, what happens is then you start to get clawing or a hammer toe. Yeah. And when patients get shoes that are missized, you'll notice this, especially for long distance, they'll start to get the toenails black. It's because the toes are hitting the end of the shoe. Not good. Not good at all. So the recommendation that I have for patients is try shoes on in the afternoon. That's when your foot is swollen the most. That is a great idea. Yeah. And what about surface, real quick? We got 30 seconds. Surface, I would do soft surfaces. Grass is great. You know, golf courses are good, soft surfaces. If you're going to run on hard surfaces, you need better shoes, better socks, and that'll be better for your foot. What about the beach? Beach is great. Yeah. Extra exercise because you're digging in. It's harder to run in. So. Right. All right, doctor. Appreciate it. Nice to meet you. Thank you. Great tips. All right. Get out there and run now, or just do some fast walking on an incline treadmill. All right. We'll be right back with more Daytime right after this.